Hey guys, Cullen here with Strive Medicare. Today I want to guide you through Medicare Advantage plans so that when the 2023 plans are released, you are prepared and ready to make the best choice. And make sure you like and subscribe so that when the 2023 plans are released and we release the prices and plan details, you'll be the first to find out. So first of all, let's talk about Medicare Advantage plans, what they are and how they work, so that you know what types of plans are available. I want you to go into this AEP, this Annual Enrollment Period, October 15th through December 7th, primed with the knowledge required to make the right choice. And so today, I can set you up for that, talk about each type of Medicare Advantage plan, and basically create a funnel, if you will, where we'll go through each type and lead you to the one that is the best choice for you, so that when those 2023 Advantage plan prices are released, and coverage details and copays and premiums and all of that, you'll be ready to make the right choice for you. So let's talk about how Medicare itself works. You've got Medicare A, B, and D as your primary coverage. Medicare Part A is inpatient, Medicare Part B is outpatient, Medicare Part D is prescriptions. If you want to know more about the ins and outs of the Medicare program itself, check out our other videos for that. Medicare Advantage plans are called Medicare Part C, and what Medicare Part C does is it combines A, B, and D to provide you coverage. Now, Medicare Advantage plans themselves are not Medicare, and Medicare itself doesn't provide you any coverage when you are on a Medicare Advantage plan. What they are insurance plans offered by private insurance companies that are endorsed by Medicare. And so all of your coverage then goes through Medicare Part C, through the Medicare Advantage plan, and A, B, and D do not provide you any coverage. So there are three popular types of Medicare Advantage plans. We'll put them up here now. You can see that there are PPOs, HMOs, and PFFS. So a bunch of abbreviations here. And so as we look through these, kind of think through which might be the best for your situation. First, we've got HMOs. These are called health maintenance organizations. And in some ways, these might be the most typical type of health insurance that you have under 65. They are contracted through specific hospital networks most of the time. And they do provide, in the Medicare Advantage world, they do provide lower premiums and typically lower out-of-pocket costs and copays because of the strict network limits. There's no coverage out of network, but often emergency coverage. And so who does this plan fit? HMOs work well for people who live in network or near their favorite hospital and they don't plan on traveling or spending time elsewhere and don't want to see other doctors or hospitals or specialists. And so it works really well if you go to the one doctor and you want a low premium and you're okay with those restrictions. Next, you have PPOs. This is preferred provider organizations. These plans typically have no network limits or less network limits, but higher copays and out-of-pocket costs because of the flexibility to use any networks. There's also no referrals to see specialists, and they're very easy to use. This type of plan fits someone who's maybe wants to use a specific hospital network and there isn't another plan option available to them, or if they travel a lot, or if they want to use specialists at other clinics or hospitals that are not local to them. It just provides you a nice flexible network option, but again, keep in mind, can have higher premiums and higher out-of-pocket costs. And lastly, we have PFFS, private fee-for-service plans. So with these plans, the insurance company determines fees for the services that you want to use. And And with this, though, you can typically go to any provider that agrees to the terms of service, no referrals for specialists, and you may have to pay the different amounts for services that are not covered, or a percentage of the difference that the provider does not want to pay. And so this plan fits people who want the flexibility to go to any doctor. Sometimes the PFFS plans they come at an even lower premium than the PPO, but understand that there can be higher out-of-pocket costs if you have to pay the percentage that the provider does not agree to cover. And so who does this plan fit? Similar to the PPOs, these plans, similar to the PPOs, this plan does provide good network flexibility. And maybe this person is okay with more out-of-pocket costs for a lower premium than the PPO plan. Or even typically a PFFS is available where a PPO is not, and you want that flexibility and you don't want the HMO restrictions. And so it's just best to understand which type of plan is best for you. Do you want to travel? Then maybe a PPO is best because you can use it pretty much anywhere. Do you want to use it at a couple different hospitals in your area and you're okay with paying more out of pocket for a lower premium? Then the PFFS might be your fit. Or maybe you want to use one specific hospital network and you're okay with that, then the HMO is what you need to look for. Now, as you can see here, all of these Advantage plans typically include extra benefits beyond Medicare A and B, and this is often why they were titled Advantage plans. Dental, hearing, prescriptions, vision, all of these benefits you can get, and sometimes more, like gym memberships or coupons for over-the-counter medications. These additional benefits can be added to specific Advantage plans, but typically on a case-by-case basis. So an HMO is not guaranteed to pay your gym membership, though some of them do. Same thing with PPOs or PFFs. Any additional benefits can be added and often advertised. I'm sure you've seen them all. So those are the three types of plans. And if one is starting to sound like a good choice for you, make a note on it and start researching them more. I just gave you a brief overview on them, but do your homework and watch some of our other videos and start to understand how an HMO, PPO, or PFF works in detail. But you're not going to be able to know the specific details of those coverage amounts until the 2023 plans are released, and we provide you those details, whether in a video or in a one-on-one consultation with an advisor here. So some other things to consider when choosing an Advantage plan. So you like an HMO, you want the low premium, and you're okay with the network limits. Now, how do you choose one? Because a lot of you out there are going to have a bunch of different Medicare Advantage plans available. And so there's a couple more things I would probably recommend here. First of all, don't choose the plan with the most advertisements. That's obvious. If a celebrity is pushing a plan, it's just because they're getting paid. It's not because the plan is the best fit for you. It could be a great plan, but if your doctors are not in network, now it's a bad plan. So make sure you work with an advisor to know the details of the coverage. And also, Medicare has put together a 5-star system where the Medicare Advantage plans are rated. This is a very easy way for you, the consumer, to make a plan choice. Medicare uses 5 different criteria to provide the 5-star system. The first is how well the plan helps you stay healthy. Does it cover screenings, vaccines, preventative care? Medicare wants to make sure that the Advantage plan is keeping you healthy, not just addressing issues when you are unhealthy. Next, it gets a star rating based on how well the plan manages long-term illness or chronic care. Medicare also uses plan responsiveness and care as a criteria for the star rating. Also, member complaints. Are there problems getting services or referrals, or are claims being denied? These are important things that are reflected directly into the 5-star system. And lastly, Medicare uses customer service as one of the 5-star reviews. So as you're looking through Medicare Advantage plans and you've chosen one of the 3 in the funnel, the HMO, the PPO, the PFFS, and you see a PPO that's 3 stars and a PPO that's 5 stars, there is a very real chance that the 5-star is going to provide you a better experience with your health insurance. And so that's an easy way for you to make a choice if you're not working directly with an advisor like us. Of course, I'm going to recommend you the 5-star and talk if the 5. Of course, I'm going to recommend you a 5-star if it's a good fit for you. For example, don't choose a 5-star HMO if it's not in your hospital network, or don't choose a 5-star HMO that has a high out-of-pocket, high deductible, high max out-of-pocket if you are currently doctoring for things, because then you're going to immediately pay a lot out of pocket even though it's a 5-star. You can find the star ratings at Medicare.gov or calling 1-800-Medicare or working directly with an advisor like us to go through the plans in the area and talk through the star ratings, talk through the networks and out-of-pocket costs once those are released for 2023 in the annual enrollment period. A few other things about the star ratings that you can use to your benefit. If a plan has 3 or fewer stars for 3 years or more, it is declared as low performing. And if you're on that plan, it's notified. You'll be notified of that. Also, if you are not on an Advantage plan, so you're on a Medicare supplement or not just original Medicare, there is a 5-star special enrollment period where you can switch to a 5-star plan any time of the year, not just in the annual enrollment period, which is a sneaky little thing to know. If you missed your initial enrollment period and want to join an Advantage plan, you can do that any time of the year. With AEP, the annual enrollment period, and the 2023 plan information coming out right around the corner here, we want to make sure you are set up for success. And the best way to do that is to address your specific questions, situations, budgets, networks, all of those things by scheduling a free consultation to you on your time. I always promise 2 things: that it's entirely free and that it will take less than an hour. We can do that over the phone, over Zoom, over in person if you're local, any way that we can help you whenever you want, any time of day. We're here for you. So click the link in the description to get access to our calendar. Times are filling up. People are worried or excited or want to know about 2023. And so get in there, get your spot, and we'll get you all set up for the annual enrollment period and for the coverage that's around the corner in 2023. I look forward to talking to you and making sure that we have you all set up for the next year.